Hello, and welcome to I'm Sick, Not Crazy, the podcast that helps you to take control of your own health and healing. My name is Jennifer James, and I'm a licensed and practicing psychotherapist here to talk about becoming your healthiest self, both physically and psychologically. Hello, and welcome back to I'm Sick, Not Crazy with Jennifer James, marriage family therapist. And I wanted to talk today about something that I'm actually quite passionate about, which is my belief that the way that patients are treated by Western medicine often leads to a form of medically induced trauma. So I want to tell you how this idea came to me. Last week, I got the clean out the closet bug, and I decided to start with my bathroom medicine cabinet. So, as Marie Kondo says we should all do, I pulled everything out of the cabinet, dumped it all in the sink. So my sink was just full of random pills and personal hygiene products. And so then I wiped out the shelves, and then I examined each item in order to decide whether to keep it or throw it away, as you do. So quickly, I discovered that this wasn't really a normal clean out the closet moment. This was the moment that I had unwittingly chosen to throw away all of the expired bottles of medication from my illness in 2011, which I've talked about in previous episodes. So the bottles had been sitting in my medicine cabinet for 9 years. Not this particular medicine cabinet necessarily, because I've moved a couple of times, but I just kept putting them in boxes and putting them back in the cabinet, apparently, because I wasn't really ready to look at them, and I wasn't necessarily ready either to let go of these medications because they had helped stop my death, and the idea of letting them go was terrifying. So I sat with that for a moment, and I took a deep breath, and after checking each bottle and checking the expiration dates, I threw them all in the trash, except for one, which was the Zofran. After 9 years, I was still not ready to throw away an expired bottle of anti-nausea medication that I no longer use. That's how traumatized I was by suffering through a year and a half of nausea and vomiting and not being able to eat. So, ironically, I had the time to perform this little mini purge of my bathroom cabinet because I was listening to a continuing education course, which was taught by Dr. Bessel van der Kolk, who is a very famous psychotherapist and medical doctor. He wrote the book, The Body Keeps the Score, which is an incredible book about how our internal nervous systems hold trauma and how important it is to use physical therapies in order to work these traumas out of our nervous systems. And the physical therapies he suggests are things like EMDR, body work, yoga, neurofeedback, some things that probably we'll talk about in episodes to come if you want more information. So I was listening to his education, which is something that therapists need to do to support their ongoing education and also to keep their licenses. And so I'm working while I'm listening and kind of looking at the slides. And one thing that he said made me pause as I was going through my old medications. And that was when he said that there are two experiences that lead to the formation of post-traumatic stress disorder. The first experience is what happened, the trauma itself. But the second piece is not being seen and supported by your community. And he talked about a really interesting example, which is the bombing of the World Trade Center on September 11th, 2001. According to Dr. van der Kolk, very few people who witnessed this terrible event in U.S. history developed post-traumatic stress disorder because they were supported openly by their communities. There was no shame in the fact that they had experienced this trauma because they had all experienced it together. And so people could speak to each other authentically about what had happened and how they were feeling about it, and they could receive support from other people who understood. However, in many more personal traumas, the trauma itself is more private, and the experience of being supported and witnessed is missing. For example, for rape victims, there's a wall of disbelief and victim blaming that keeps them from getting support and telling their stories. For incest survivors, there's shame. There's years of being afraid that if they ask for help, things will only get worse. And as we know from Brene Brown's work, silence breeds shame. And the more unable the victim is to share openly about what happened, the more the shame grows, which leads to a perfect breeding ground for post-traumatic stress disorder. So as I stood there, frozen, listening to Dr. Vanderkolk explain how it isn't just the traumatic experience that leads to post-traumatic stress disorder, it's also the quality of support from the community, I began to fully realize just why the illness I'd gone through was so intensely traumatic for me. The medical community did not see me as I came to them for help. Instead of believing what I told them about my neck injury and my subsequent illness and helping me to find a treatment, they told me that the neck injury I had sustained couldn't actually be the cause and that it was really only anxiety. Then they prescribed anti-anxiety pills and sent me home. So I wanted to list a few of the things that medical providers said to me during my search for help because I'm thinking that maybe some of you can relate. So here's one that was said by the first neurologist I saw. He said, "Your symptoms don't make sense." Here's another one. "Oh, you again." That was said by an emergency room nurse who must have attended me on a previous emergency room visit. Here's one from an emergency room doctor. "You seem pretty anxious. Maybe you should admit to yourself the possibility that this is all just caused by anxiety and perhaps some mild depression." And then this one, which was said by yet another neurologist. "I think this is something that's just going to get better with time." Anyway, you get the idea. They just really didn't see me at all, and they invalidated my experience and minimized the fear that I was feeling as a result of the severe physical symptoms that I was going through. And that fear was the result of those symptoms, not the cause of them. Perhaps even worse, because trained nurses and physicians, without any evidence, blamed what I was experiencing on anxiety, so did some of the people in my life that I desperately needed to validate and support me. As a result, except for a couple of truly incredible people who stepped up to the plate, I went through a 1.5-year-long illness mostly alone. It's been my conviction since the time of that illness that the callous treatment I received from medical practitioners made me sicker, but I've had trouble articulating exactly just why. Suddenly, it's clear to me that each time a doctor told me that it was probably just anxiety, or a nurse greeted me with, "Oh, it's you again," when I went to the emergency room, my nervous system was becoming more and more traumatized by not being seen and helped. Unfortunately, this treatment is deeply rooted in the medical system due to the medical history of hysteria. So most of us think of hysteria as usually a woman who kind of loses control and, gets really upset and crazy. But that is not the historical medical term for it. So it was a medical term for many types of medical symptoms during the Victorian era that they didn't know the medical cause of yet. They believed that these symptoms were caused by the repressed emotions of the patient. Since that time, we have found that many of the groups of symptoms that they called hysteria were diagnosable symptoms. Here's a list of just a few. So they used to believe that asthma, fibromyalgia, chronic fatigue syndrome, endometriosis, and epilepsy, just to name a few, were hysteria. Now, they don't necessarily use the term hysteria anymore. They would probably use something more like somatoform disorder, but the idea is still very alive. And doctors are encouraged to root out the people that are, having symptoms from emotions from the quote unquote truly sick people so that they can focus their efforts on people who they believe are treatable. So this is important because even when the patient denies being anxious or depressed, the doctors don't necessarily trust them because of the very foundation of the idea of hysteria is that the emotions are repressed and the patient doesn't even know about them. So what happens is that patients who don't readily fit into a diagnostic box are dismissed without any testing or treatment. In a medical system where patients unfortunately don't necessarily get to see the same doctor again, the doctor who makes this decision often doesn't find out the result of that decision. Also, patients who are dismissed are very likely to change doctors. So they can go through multiple doctors before they'll get to somebody who will actually do testing and give them a diagnosis that will be treatable. And again, that first doctor or several doctors who dismiss the patient never find out that there was a treatable syndrome underneath. This is a serious issue because what happens is that diagnosis and treatment are delayed. Sometimes they're delayed for years. And I've read stories of cancer patients who died because doctors would not listen to them, and their lives could have been saved if they had just had a simple test done instead of being sent home with a, "You're fine, it's just anxiety." So I would like to submit that the damage caused by the idea that repressed emotion is the cause of these outside-of-the-box symptoms is much worse than just misdiagnosis and delayed treatment. It's also the cause of what I would think of as a medically induced trauma. Patients whose terrifying medical experiences are dismissed out of hand without testing are experiencing both of Dr. Bessel van der Kolk's criteria for PTSD, a traumatizing event, which is the illness, and an unsupportive community, the dismissive medical professionals. It's my hope that by sharing this realization with you, I'm taking a step towards changing the way that the medical community interacts with patients. It doesn't cost anything to listen to someone. It doesn't cost very much necessarily to do a test. And the cost of not listening and not paying attention is great in both traumatized patients and lives lost. If you have experienced or are experiencing a wall of disbelief from the medical system, you are not alone. Please continue to advocate for yourself and keep asking to see another physician for a second opinion until you get someone that will help you. You are the authority on your own body. You live in it every day and know what you're experiencing better than someone who met you 5 minutes ago and came into the room with a historical bias of medical hysteria. In my own case, I went through several neurologists until I got to an inspired neurologist named Dr. Ian Purcell, who has the Senta Clinic here in San Diego, and he's a super specialist. He and his staff listened to me, and they never once blamed me for my symptoms. They never told me that I was suffering from anxiety. And through a combination of medication, physical therapy, and yoga, I got well. And I really hope that you continue to try until you get to your Dr. Ian Purcell. Thank you so much for listening. If you would like more information, please go to Dr. Bessel van der Kolk's website. You can also check out his book, The Body Keeps the Score. And Dr. Bessel van der Kolk's website is just besselvanderkolk.com. Also, you can check out Dr. Ian Purcell's Senta Clinic if you're interested in a neurologist. Thank you so much, and I look forward to talking to you next week. Take care. Bye. Thank you for listening to this week's I'm Sick, Not Crazy podcast with myself, Jennifer James, MFT. Please remember that this podcast is educational in nature and that it's not intended to substitute for medical or psychological advice. To learn more about my work, to share podcast topic ideas, or to book me for speaking engagements or interviews, please visit my website at jenniferjames-author.com and choose the contact link. If you would like to support my work financially, you can find me at patreon.com/jenniferjamesmft. Thank you, and remember that you can take control of your own health.